We heard here over and over again that diabetes is associated with hard endpoints like myocardial infarction, stroke, and heart failure. However, before that happens, usually the individual got different kind of impairments in the cardiovascular system, so-called subclinical cardiovascular disease. So that's what I was investigated in this study, which is a population-based study of about 500 subjects, all with the same age of 50, in which we have measured those guys very, very, very carefully when it comes to cardiovascular function. We undertook 3 measures of endothelial function, 3 measures of arterial compliance. We did heart rate variability measurements. We looked at blood flow in different arteries as well as atherosclerosis with ultrasound. We performed a maximal exercise test with gas exchange. We looked at the heart geometry as well as function, as well as lung function, and we measured actually blood pressure in 5 different ways in this population. In addition to that, the guys in the study performed an oral glucose tolerance test, so we can classify those into having either normal, impaired glucose tolerance, and diabetes. And then we looked at which of all of these markers, which you can see here, it's quite a bunch of markers of subclinical cardiovascular status was most closely related to a deteriorated glucose tolerance. And these guys spent about 2 days in the lab doing all of these kind of measurements, so it was pretty heavy for them. And surprisingly, out of all of these more or less sophisticated measurements, the one that came up as the top variable being related to an impaired glucose tolerance was the simple measurement of heart rate. So that was a little bit astonishing there. The second one that came up was the maximal workload at the exercise test, and also the recovery of oxygen consumption following the stop of the exercise test. So how fast you can lower your oxygen consumption from the maximal value. These analyses between the groups were also adjusted for the influence of obesity, because obesity as such has a profound effect on the cardiovascular system. So these are mainly the relationship to the glycemic state in itself. Thank you.